Well, today on the show, we're at Stone County Hospital in Wiggins, and we're talking to Don Bogus, who is the clinic manager here. How are you? It's good to see you.
I'm good. How are
again.
you? Very
well,
good.
I'm doing well. Tell us a little bit about Stone County Hospital. I mean, you have the clinic here, and then you also have one in Poplarville.
We do. We're a full-service medical clinic. We have physicians, nurse practitioners. We also have specialty physicians like general surgeons, orthopedic surgeons, cardiology, urology, podiatry, and OBGYN services. So you can see all of the physicians you need to see right here in Wiggins.
That pretty much covers the whole gamut of anything that ails you.
Yes, absolutely.
Now, what about patients? What is age-limited patients?
We see everything from babies to seniors, so we can treat the whole family right here in Wiggins.
Now, if I don't have a physician, a regular physician, can I come here? Can the clinic staff help me?
Sure, absolutely. We can make an appointment with any of our providers. We're open Monday through Friday, 8 to 5, but walk-ins are also welcome.
And what about insurance?
We take all insurances, Medicare, Medicaid, and most all private insurance.
Okay, and tell us exactly where you're located.
We're at 1434 East Central Avenue in Wiggins. It's right off Highway 26.
All right, well, we're going to talk to one of the nurse practitioners right now at Stone County Hospital in Wiggins. Now, Becky Harris is a nurse practitioner here at Stone County Hospital. How are you? Good to meet you.
I am well, thank you.
Tell us, what exactly is the difference between a nurse practitioner and an actual physician? What similarities do you have?
Well, a nurse practitioner is actually a registered nurse with an advanced nursing degree and training that can manage both acute and chronic illnesses by diagnosing, prescribing, maintaining. If needed, we can do referrals or consults for whatever our patient needs. The care dictates. We work well with physicians, we collaborate with other healthcare professionals, and we meet the needs of our patients. We're a valuable tool to residents of South Mississippi.
So if someone needs a referral for a specialty thing like that you do, like an MRI or a sleep study, you can actually do the referral for that.
We absolutely can. In whatever specialty or area that the MRI or CAT scan would be needed, we can either have it done so they can go to the specialty with the imaging results, or we can get the referral that we need to order from that specialty physician and have it completed.
What type of patients do you see on a regular basis?
My specialty is family practice, so I see patients through the lifespan from birth until geriatric elderly patients, and I love them all. Yeah,
they're great. Now, I guess common colds, things like that?
Everything and anything in between.
Now, I do understand that you have a special expertise, though, in sleep studies, sleep screenings.
Yes, at Stone County Hospital and Clinic, we do a lot of referrals. We receive a lot of referrals for sleep medicine, and we will have referrals come in, and we will actually take those patients to the sleep lab and complete the study.
I've been there. One time we were up here last year, and they hooked me all up and showed, basically how it goes and everything.
And it's not so bad, is it?
No, not really. I mean, I didn't actually go to sleep, but I mean, it's something that I've actually been considering doing because I know I have a problem at night sometimes, snoring, and sometimes that can be diagnosed as a serious problem.
Yes. Sleeping disorders can lead to very serious health problems later on, and we're now realizing how important it is to actually diagnose and treat these patients with sleep disorders.
Now, what is special about practicing here than any other hospitals?
Stone County is actually my home. I'm from here, and I know that you've heard the slogan, neighbors serving neighbors, but that's actually true for me. My patients are my neighbors, and I care.
Well, it's a small community.
Yes.
I mean, I've been up here. Matter of fact, I actually started my broadcast career in Wiggins.
Really?
A long time ago, back in mid-70s, WIGG in Wiggins was the first real radio station that I worked at.
That's awesome.
So I do
got your big start.
I did, and so I do actually have some roots here. So I appreciate very much great information from you, and I may be calling you about that sleep study sometime soon.
We can fix you right up.
Well, thank you very much.
Thank you.
One of the other things that we have a special we're going to talk to is about podiatry. We're at Stone County Hospital in Wiggins. Yeah, that's my foot. As scary as it is, my talons that are on there. Dr. Renita Parker, podiatrist.
Hello.
How are you?
I'm good. How are you?
I'm doing well. My foot's a little chilly though, but
We'll warm it up.
Well, thank you very much. Tell us about the services offered as far as podiatry here at Stone County Hospital Clinic.
Well, I am a podiatrist here at Stone County. I do primary podiatry, wound care, and surgical podiatry as well. And I do that Monday and Tuesdays for regular appointments, and I do surgery on Wednesdays. And I also do clinic in Poplarville on Thursday afternoons.
Well, let's talk about foot problems.
Sure.
You know, when I took my shoe off, first thing you said, flat foot.
Yes.
Yes, I am. And I do wear a little support in my shoes.
Good. I'm proud of you.
Thank you. Thank you. What are some of the things that maybe people could be aware of as far as that could cause, you know, foot problems?
Okay. Well, if you have misalignments of your foot, like you said, you have a low arch, you may have bunions or hammer toes or painful calluses. All of those things should be evaluated by a podiatrist like myself to make sure that you're not setting yourself up for further problems down the road.
Now, as a child, I ran around barefooted all the time.
It's part of Southern life.
It really is. And even as an adult, I still do sometimes run around the house, or I'll go out to the mailbox or something like that, or because I still like the feel of grass between my toes or things like that. But doing things like that can actually cause problems for you.
You can. I've had a lot of patients, whether they are 5 years old up to 95 years old, that come in because they've walked around barefoot, they've stomped their toes, children walking around in the grass, they've ended up getting a piece of wood stuck in their feet, and we end up having to pull that piece of wood out either in the office or over at the hospital in surgery. So I try to educate people, don't walk around barefoot.
What kind of problems down the road can improper foot care create for someone?
Well, if you are diabetic, that's the number one thing we like to educate our patients on.
Right.
You should come in to make sure that you have your initial evaluation to be sure that you are not a high-risk diabetic where you can possibly have ulcerations, toenail fungus, or you could lead to amputations of the toes as well as the foot as a whole. So we try to educate everyone that comes in, whether you are diabetic or you have a history of diabetes in your family, to be sure that you are not susceptible to any problems. So you don't have to meet me behind a mask.
Right.
You know?
So what if someone needs to make an appointment? They can just call here?
They can. You can have either a referral from your primary care physician, or you can make an appointment here at Stone County Hospital on Monday and Tuesday, which I'm here in clinic, and I'd be happy to see them and help them with their problem.
All right. Dr. Renita Parker is the podiatrist here at Stone County Hospital. Thank you so much.
You're very welcome.
For
Thank
your
you.
time, and I'll be sure to keep wearing my arches. So
good job.
Thank you very much. A lot of wonderful things that you may not know that they have here at the Stone County Hospital. If you need them for anything, numbers on your screen, give them a call, set up an appointment. Stone County Hospital.